Okay, it's 7 o'clock, so it's time to get started. We are thrilled to have Dr. Kate back with us today from Natural Factors to talk about heart health from the inside out. So a little background on Dr. Kate. She is not only a busy mom, a naturopathic doctor, educator from Natural Factors, but she's also an author of the K2 paradox. She'll correct me on that, I'm sure. So we're very excited to have Dr. Kate with us. Before we dive into our presentation tonight, just a couple of things, a couple of housekeeping items. The presentation will be recorded and sent to everybody who's registered. If you have any questions, we ask that you put them in either the chat window or the Q&A section, and those will be answered towards the end of the presentation. And of course, most importantly, have fun, enjoy your time with us tonight. And one other big announcement, this Saturday, Nutters is celebrating 40 years. And that includes a fantastic relationship with Natural Factors, which is practically as long as Nutters has been around. So be sure to pop into your local Nutters. There's going to be cake and prizes and sales, and it's just going to be a huge event. So please do stop in and say hi to everybody. And without further ado, I will turn it over to Dr. Kate.
Thanks, Michelle. Hi, everyone. Welcome. It's so nice to have so many people taking time out of your busy schedules to take steps to improve your own health. Be proactive about that. I love that. I'm sorry if you can't really see me. I don't know what's going on. I've got a ton of lights like on in my office, and yet in the little box, I look like dark and gray. So I don't know if that's the camera or what's happening. So do apologize, but it's more to do with what I'm saying than being able to see me. We're going to be speaking about heart health, but hopefully from a more functional perspective. My idea is to challenge a few of the ideas or concepts that you might have about heart health and help you have some more news you can use, like meaningful information about how to stay heart healthy. So feel free to type questions in the chat area if you have burning questions as we go along, and I will address them at the end. And that I usually like it when when we can be live together to take questions as I go along, but in the webinar format, that works better. And I gotta advance, here we go. My window's over my slide advancer, and I am Naturopathic Doctor Kate Rhéaume, as Michelle mentioned, graduate and former faculty member of the Canadian College of Naturopathic Medicine. I am the author of this book, Vitamin K2 and the Calcium Paradox, How a Little Known Vitamin Could Save Your Life. And it's a topic that's very pertinent to heart health as well as bone health. And I speak on many topics related to health and wellness, but this is one that's of special interest to me because I feel like there has been lots of misinformation, or perhaps information that has been so useful and helpful for us in this department. And it's one that's really important because heart disease is the leading killer of men and women in all of North America, really in all of the Western world. This is a real big concern. So cardiovascular disease, so that we're all using the same language and clear on these definitions. Cardiovascular disease is an umbrella term that includes a wide number of conditions, really any condition that affects any part of the heart or circulatory system, and even that includes the blood vessels in the brain. That is all part of cardiovascular health and cardiovascular system. Heart disease as well is a general term that encompasses all kinds of problems that can happen to the heart, the health of the heart valves or the muscle itself, the heart rate. There's all kinds of things that can fall under the category of heart disease. But specifically for the purposes of this presentation, when I say heart disease, I'm referring to primarily coronary artery disease, which is a disease that affects the, one or all of the three major arteries that feed the heart. So when you hear about people having a heart attack, it's typically because there was a problem with one of those coronary arteries. And this is usually caused by atherosclerosis or what we call sometimes hardening of the arteries in one of those blood vessels, the main arteries that feed the heart. But we'll also cover other aspects of heart health and blood vessel health. But really, these are the main things that people are concerned about. And what I say and the information I give also applies to, blood vessel health in the brain. But this is the heart attack, as I mentioned, is the main killer. And I'll mention a few other things like heart failure, which can come up. So let's look at a few heart health myths and facts, because these have been, really ones that have led us astray. For example, the biggest myth around heart disease is that cholesterol causes heart disease. And this has been, for a long time, the focus when you talked about heart health was cholesterol almost entirely. If your cholesterol is high, first of all, get a cholesterol test. And if it's high, take medications to lower it. And if it's high, that will cause heart disease, it clogs up your arteries, that kind of thing. But the fact is that 50% of all heart attack patients have normal cholesterol levels at the time of their heart attack and no history of ever having had high cholesterol. So that's problematic, because that means that you can have your cholesterol tested and have it be normal and think, great, no problem, I have no risk of heart disease. But half of people who have heart attacks have normal cholesterol. So just because your cholesterol is normal doesn't mean you won't have a heart attack. On the flip side is just because your cholesterol level is high also doesn't mean you're going to have a heart attack. I have the references here, by the way, if anybody's interested in the research. This is just one of many studies that shows the same findings. But the question that I would normally pose to a live audience, harder to do in a webinar, is, are cholesterol levels a good predictor of having a heart attack? I guess I just almost gave that away. This is a rather technical study, but from the British Medical Journal, very reputable journal, showing that there is a lack of association. In other words, no correlation. High cholesterol doesn't mean more heart attacks. So there's a lack of association or an inverse association between LDL cholesterol, that's so-called bad cholesterol, and mortality, dying of any cause, particularly heart attack. And an inverse association means that what we see, in fact, is slightly higher LDL cholesterol is associated with a lower risk of heart attack, dementia, and overall mortality. What does overall mortality mean? Obviously, we're all going to die, so that doesn't offer a protective effect against dying, but lower mortality means, say they do these studies over, let's say, 10 years. And in this 10-year period, for example, I have to read the study, how many years it was, but let's just say in this study period of 10 years, people with slightly higher LDL cholesterol were less likely to die during that study period. So this is completely the opposite of what we've been hearing for so long. And yet the whole lipid hypothesis, or cholesterol clogs up our arteries causing heart attacks, there was never a lot of good research behind that. And it would seem that slightly elevated cholesterol seems to offer us something of a protective effect against all kinds of concerns. So, one of the most common questions I would get asked from people is, what, my cholesterol is a little high, my doctor wants to put me on a statin. I am not here to challenge or refute or overturn or tell you to go against your doctor's orders, but looking at this kind of research, a little elevation in cholesterol, especially if there's no other concerns, there isn't an extensive family history or personal history, no previous heart attacks, that kind of thing, a little bit of elevation in cholesterol is no reason to take a drug to lower it. If anything, it's reason to celebrate and think, oh, that's not a bad thing at all, especially for women. Different research on that. But that is something to be aware of. So if you're here because your cholesterol is up a little bit and you don't know if you should take a statin or not, this research from the BMJ suggests maybe you shouldn't. Okay, so cholesterol and heart disease. The fact is, cholesterol is a factor in your overall heart disease picture, but it's not the only one, and arguably not even the most important one. It's not a good predictor of your risk of whether you're having a heart attack. In other words, they look at studies of people with high levels of cholesterol, over the study period aren't necessarily more likely to have a heart attack. High blood pressure, yes. Smoking, yes. Sedentary lifestyle and being overweight and or diabetes, yes. But just cholesterol, no, it's not a great predictor. And for women, there is no correlation between cholesterol levels and risk of having a heart attack. It just simply does, you cannot use it to predict whether you're going to have a heart attack. You don't need to be overly concerned about your cholesterol levels. However, if your cholesterol both good and bad, and keep in mind when you look at cholesterol, just because the LDL is high, if the HDL, the good cholesterol, is also high and the ratio between them is, they're both up, that is very important, especially if you have HDL cholesterol that's over 2, that's really good. And I wouldn't be concerned about other things unless there's also, like I mentioned, other risk factors like diabetes, overweight, smoking, not exercising, or some other relevant concern. So cholesterol levels increase due to inflammation in the body. So in other words, if they're high, that may be tipping you off to other things that you can look at for your heart health that you can address that are important. So in getting inflammation down, addressing high blood sugar, as well as high insulin levels. So if your blood sugar is up a lot because you're eating a lot of sweets and starchy foods, white processed flour, insulin levels will also be high, and that's problematic for diabetes as well as heart disease. And keep in mind, when cholesterol is there, even the so-called bad cholesterol, the LDL cholesterol, it is actually only really bad when it becomes oxidized. So when cholesterol is circulating in the body for a long time, it's not reaching its receptors, it can become oxidized, sort of like rusting. And that's when cholesterol is problematic. How do you prevent oxidation? I'm sure you all know you can do that with antioxidants. So we can keep the cholesterol that we do have working for us and keep it good. Even if it's LDL cholesterol, we can keep it from becoming problematic or potentially problematic by making sure it doesn't get oxidized. That's more important. You can check to see if your cholesterol is oxidized. It's a test you can ask your doctor for called an LPA test. And that's something to consider. But in the meantime, I would make sure that you've got lots of antioxidants in your diet. We'll talk about that in a little bit. So if all of those things, or if cholesterol rather, is not a good predictor of your risk of heart disease or heart attack, then what is? Because we've heard that for so long, it's been a guideline, that's what we've been following. So cholesterol is not a good predictor of whether or not you're going to have a heart attack, but the amount of calcium you have in your coronary arteries is an excellent predictor of your risk of having a heart attack. And there's studies that can be done. Now, these aren't that easy to get in Canada, but it's a specialized type of CT scan. These are offered everywhere in the United States. And if you happen to go down to the US for any reason, you can probably find a center that offers them. You usually don't need a prescription, or if you do, they're easy to get. They may cost you, well, I'm sure the prices have gone up by now, but a few $100s, maybe even at this point, probably $300 or $400. And it's a super fast CT scan that can image a beating heart in still. It's not the common type of CT scan that you'd find in most hospitals that are good for imaging stationary organs like brains, for example, but specialized high speed CT, and it can take pictures of the coronary arteries and measure the amount of calcium that's in those arteries. And the amount of calcium correlates very well with your risk of having a heart attack within 5 years of having this test. After 5 years, the amount of calcium can change, so that risk changes, but it's not a crystal ball, but it is pretty darn close. It's really well correlated. And so cholesterol is not a great predictor. It's not a good way for you to know whether or not you're going to have a heart attack. But the amount of calcium you have in your arteries really is. So what if, well, first of all, let's talk about some heart disease risk factors. Then we'll go back, because at this point you're like, Do I have calcium in my arteries? How do I know? What if I can't get down to the States for this test? Let's look at some other things to be aware of. I've already mentioned a few of these. Heart disease risk factors, that most of which we can control, is carrying extra weight, especially abdominal weight. You don't need to lose a lot of weight to reduce your heart disease risk. Even just losing 5 to 10% of your body weight can make a significant difference in lowering the risk of a heart attack. High inflammation of the body. How do you know you have high inflammation? Well, if you have any kind of painful condition, any kind of itis, arthritis, for example, something that you know there's inflammation there because it's causing pain, that's an obvious one. But there can be painless inflammation. There can be inflammation in the arteries that you don't feel. So there are tests that you can have done, again, as part of your annual blood work. CRPC reactive protein is one of them. This is a marker of inflammation that's non-specific. So in other words, if it's high, you don't necessarily know why it's high or what's causing it to be high, but it can contribute and tip you off that, okay, maybe you need to do some more things to counteract inflammation. We'll talk about that. Smoking is a no-brainer. Everybody knows that. Being a couch potato, that will increase your risk of heart disease because it causes inflammation. Having diabetes, or even if you're not diabetic, often having high blood sugar, that's concerning. And that means that you're eating lots of foods that are sweet or starchy or getting your blood sugar up. And then finally, the only risk factor, important diabetes risk factor that we can't control is family history. But just because everybody in the family had a heart attack at a certain age doesn't mean that you're going to, unless you have the same diet and lifestyle and stress levels as everybody else in the family. And stress levels is another one that I don't have on this list, that is extremely important because stress, again, will cause inflammation, and that can impact our heart disease risk. So one of the most common questions I get asked is, should I take a statin? Like I said, I am not in any position to tell you not to follow your doctor's orders, but everybody has a choice as to which medications they are going to take. And statin medications, because this is one of the most common questions I get asked, they do absolutely lower cholesterol levels, but they don't seem to reduce your risk of having a heart attack, which begs the question, why are we taking them? And so this is some fairly complex information. There's a lot going on this slide, but feel free to look up under something called the NNT, that's called Numbers Needed to Treat, which is a website that looks at a variety of medical treatments. And numbers needed to treat means how many people need to take a certain treatment, like a certain medication, for example, statins, in order to save one person from having a heart attack. And so in terms of the benefits of numbers needed to treat, if you look at large groups of people with the same heart disease risks, compared to people taking statins, in other words, they have the same level of cholesterol and all the other heart disease risks, people taking statins compared to people not taking statins, there's no difference in their cardiovascular mortality. In other words, they will have the same number of deaths from heart disease. Not that impressive. 1 in 217 people, so of 217 people taking statins, one person will not have a non-fatal heart attack that they might have, they might be able to avoid that by taking statins. That's not a lot. And 1 in 313 people will avoid a non-fatal stroke. So honestly, a lot of people have to take this medication to avoid one adverse effect. And if that's important to you, that's fine. That is something to know. Meanwhile, 1 in 20 people will experience pain from muscle damage. Statins will cause like a wasting of the muscles, often in the legs and back. And 1 in 200 people will develop diabetes, which is about the amount, sort of the risk benefit is similar to, if we look at the side, the risks and the benefits are quite weighed. So this is something to keep in mind if you're wondering or concerning, you're on the edge, you think, oh, my cholesterol is just a little high. For people who, and this, by the way, this is for what's called primary prevention. In other words, somebody who's never had a heart attack before. If you have previously had a heart attack, there's some information to suggest that taking a statin medication may be a good choice to prevent you from having a second heart attack. So that's a different scenario. But if you've never had a heart attack, a statin medication will certainly not prevent you from dying of a heart attack, and it's only 1 in 217 chance it will help you avoid having a non-fatal heart attack. So I hope that's clear, and it just gives you some information. Again, you can check this out at the NNT. So now we have talked about ways of that maybe aren't quite so effective in managing our heart attack risk. What can we do to be more heart healthy? And again, when I say heart healthy, I mean heart and blood vessels, because ultimately the problem that happens that affects the heart or causes a heart attack starts in the blood vessels that feed the heart. There's a problem there, and then that blocks off blood flow to the heart. Part of the heart can die, the whole heart can have problems, but it's really, we're talking about the health of the blood vessels in the whole body as well as in the heart. So what's going on in our blood vessels? What's important to know is that we've for a long time had this concept of blood vessels being just, tubes that can become clogged with fat like a pipe might. But blood vessels are not simply tubes or pipes that can become clogged. They're absolutely dynamic living vessels that have a lining in them called an endothelium. It's a 1-cell layer thick lining, and this lining is actually really dynamic. It will protect and regulate the health of the blood vessel. It will release compounds to help the blood vessel dilate or contract when that's appropriate. Those cells turn over. If there's damage in the area, it can heal that. So this really, the health of the blood vessels, when we talk about that, it's really the health for the most part of this blood vessel lining, this endothelium. And when cardiovascular disease occurs, heart disease, hardening of the arteries, atherosclerosis, clogged arteries, as we say, or some kind of blockage, it's really a failure of, or that sounds a bit harsh, or a dysfunction in this lining. And so if we can keep the lining of our blood vessels healthy, that keeps our whole cardiovascular system healthy. So there's lots of things that we can do. There's lots of things that happen and lots of consequences of disease or an unhealthy endothelium. And I just happened to be struck by the abstract from this magazine, this article in the International Journal of Biological Sciences, because I found the authors here were not mincing words when they said the alterations of endothelial cells play a central role in the pathogenesis of the most dreadful of human diseases, including heart disease, diabetes, strokes, severe viral infections, kidney failure, venous thrombosis, so blood clots in veins and arteries. So all kinds of things can happen in the body if the endothelium isn't healthy. So it's helpful to think of the endothelium as an organ in and of itself. So think of the lining collectively of all of your blood vessels as its own organ. And that's really, when we talk about cardiovascular health, that's really what we want to target. And when there's problems with that, it can manifest as stroke, dementia, vision loss, memory loss, problems that we see obviously with circulation, like Raynaud's phenomenon, for example, heart attack, angina, erectile dysfunction, all kinds of issues. So when we are looking at the health of our endothelium, strictly heart health is just one part of that, but the whole cardiovascular system has an impact on many aspects of our health. Okay, so then knowing all that, that's the sort of foundational knowledge to understand what and why we now have new heart health goals. So if the old heart health goal was just simply get cholesterol down by any means possible, and that wasn't super helpful, then what are our new heart health goals? Well, knowing what we know, we want to lower inflammation, because ultimately it's inflammation, and inflammation that impacts that lining, that endothelium, where there will be problems with the lining, where there may be a buildup of plaque, or areas that can get clogged, or little pieces that can break off and cause problems. We want to prevent cholesterol oxidation, because we know that just having high cholesterol is not that big a deal, but when the cholesterol becomes oxidized, then it's a problem. We want to maintain healthy blood sugar. That is arguably more important than being concerned about the fats in our blood, is being concerned about the sugar in our blood. We want to maintain a healthy blood pressure. That's always been important. It still is important. Certainly, if your doctor tells you should be on blood pressure medications, absolutely follow that, take them as prescribed, stick with them, get your blood sugar measured, or excuse me, blood pressure measured regularly. Maintaining a healthy blood pressure is really important. And prescription medications, if they are required to do that, really make a difference in terms of preventing strokes and maintaining cardiovascular health. And finally, keep calcium in its place. Remember, one of the things I mentioned is that it's a buildup of calcium in the arteries. That's a really good predictor as to whether a heart attack will happen. And so you may be thinking, well, I don't know if I've got calcium in my arteries, and I don't know if I can get down to the States for this test. So there's things that we can do to do our best to make sure that there isn't calcium building up in the arteries, and if it's there, to help move it out. Even if we don't know whether it's there or not, because not all of us will be able to go get that test. And last but not least, support the endothelium. So these, fortunately, these things all overlap. Sounds like a lot, but actually, I'll just mention a few strategies that cover all of these things. Okay, so here's how we, as a sort of a broad overview, how to take care of our endothelium. A lot of this is common sense stuff. A lot of this you've heard before as being, heart health information, may not just have been framed as endothelium health information. So what's in green is endothelium helpful, it's good for endothelium. Exercise, obviously, it's a no-brainer. Relaxation and laughter, in particular, antioxidants, I've already touched on those, low sugar, omega-3 essential fatty acids, they're anti-inflammatory, they do all kinds of good things for us. I'll talk more about them later. And a Mediterranean diet, honestly, any kind of healthy diet. One that doesn't include fried foods. I'm going to talk a little bit more about oils shortly. But that's avoiding fried foods, lots of sugar, lots of white flour, refined processed foods that are empty calories, high amounts of additives, for example. So Mediterranean diet is a nice way to go, but you can have a healthy diet without necessarily strictly being Mediterranean. There's also then endothelium harmful things. Obviously, it's the opposite of everything that we've said is good for the endothelium is bad for the endothelium. So being sedentary, so not exercising, not moving, being a couch potato actually generates inflammation in the body that promotes heart disease. Smoking, again, it's the toxins that we find, the free radicals. So when you smoke, you have a huge free radical exposure. That's really what causes the problem. So smokers need to, well, ideally not smoke, but take lots of antioxidants. Stress, super important. Stress exacerbates any health condition, any chronic health condition. Heart disease is no exception. It really is, will add to the burden of heart disease. Free radical exposure, so having lots of free radicals because of, smoking or stress or not exercising or being exposed to lots of pesticides, for example. Inflammation, I already touched on that. So if you have any known inflammatory condition, a painful condition that's causing inflammation, then there's added reasons to help get that under control, other than it's obviously not nice to be in pain. High sugar intake, I already touched on that. A lack of quality sleep will affect the health of the endothelium. omega-6 fatty acids. So those guys are the opposite of the omega-3s in general. There are some types of healthy omega-6s that we need, but for the most part, highly processed vegetable oils from seeds, things like sunflower, canola. These are high in omega-6 fatty acids that tend to be pro-inflammatory, particularly when they are heated to high temperatures. So frying things in these kinds of oils create compounds that are extremely inflammatory in the body. So trying to get those out and instead stick with old-fashioned healthy fats like olive oil, butter, for example. These kinds of things are not big sources of omega-6 fatty acids. Trans fats, so hydrogenated fats, margarine, for example, the body just doesn't know what to do with that kind of fat, and it ends up oxidizing and causing all kinds of problems. And then a lack of key nutrients. So I'm going to focus on a few specifically heart healthy nutrients that help to heal and nourish the endothelium, and that is important for heart health. Okay, so here are some, I don't want to overwhelm anybody, and I don't necessarily have time to cover all of these, but my top nutrients that help heal the endothelium: vitamin K2, magnesium, quercetin, omega-3s, curcumin, vitamin C, and CoQ10. Like I said, that's a big list. You don't necessarily need to take all of these. I'm going to talk about where you can get a lot of these from food. Certainly if you have a personal or family history of heart disease, or you have heart disease concerns, you may want to take these, or if you have many heart disease risk factors, for example, you may want to take all of these, but I'll touch sort of briefly on some of the points about individual ones and instances in which you might want to take them. So the last one that I mentioned, I just want to mention this because if most people are aware of this, but just in case you aren't, for anybody who is already taking a statin medication, statins will deplete coenzyme Q10. CoQ10 is a nutrient that we can make a certain amount of in our body, but statins stop that production. So you can end up being depleted or deficient in coenzyme Q10, which is a real shame because it is a very important antioxidant, prevent your cholesterol from oxidizing, as well as really important for heart muscle function. So help the strength of the heart muscle cells to beat properly, as well as being an important nutrient for the health of the endothelium. So CoQ10 is an important heart health nutrient in general. It's also happened to be helpful for cognitive function, energy production at the cellular level. It gets the mitochondria, our energy producing, or the batteries of our cells, to produce more energy, or to produce it more efficiently rather. But it is one in particular that I mentioned because people who are taking statin medications will become deficient in this. And so you should top up on that if you're taking a statin. Okay, so next is the nutrient that I had on the top of my list, which happens to be the subject of my book, is vitamin K2. And the major role of vitamin K2 for heart health is in keeping calcium in the right places in the body. So I mentioned that having calcium in the arteries is not a good thing. And calcium has a tendency to build up in inappropriate places in the body if it's not kept in check. And vitamin K2 is a nutrient that will direct calcium into your bones and teeth where you want it, and it will prevent it from depositing it, and you can even remove it from places that you don't want it, like heel spurs, kidney stones, joint tissue, but it will also help with keeping arteries healthy because it activates proteins that will go and find calcium from areas it's not supposed to be and scavenge it, grab it, and pull it out. So vitamin K2 also does this by acting on endothelial cells. So it gets into the endothelium. And if the endothelium has an area that is beginning to become calcified, what's called hardening of the arteries. It's called hardening of the arteries because there's calcium building up in there. Women, for example, postmenopausal women have been shown to have increased arterial stiffness. So there isn't a one specific spot with a bunch of calcium in it, like at the picture I showed you, but all of the elastic tissues in all the arteries begin to become just a teensy bit calcified. So the arteries become a little bit stiff. And this is a risk factor for heart disease. And vitamin K2 has been shown to reverse postmenopausal arterial stiffness. And so this is because it will take the calcium out of where it's not supposed to go. So vitamin K2 in nature or in your diet can be found in either grass-fed animal food. So if you can get, say, chicken eggs when the chicken has been out on the pasture eating green grass and bugs, then those nice orange yolks will have quite a bit of vitamin K2 in them. I know that in Canada in the wintertime, it's hard to find these things like grass-fed butter or milk. That's tough, but there are other foods, certain fermented foods. So certain types of cheeses, Brie, Gouda, and Jarlsberg cheese, Gruyere, are among the highest cheeses in vitamin K2. Europeans eat lots of cheese and manage to stay heart healthy, and we can too. For my money, one of the most heart healthy snacks is Brie cheese and a glass of red wine. So vitamin K2 is important when it comes to the calcium aspect of your heart health. Arterial calcifications are absolutely an important risk factor and predictor of heart attack risk, even when your cholesterol levels are normal. Calcium-laden plaque can be lurking in the arteries, and vitamin K2, as I mentioned, has been shown to reduce arterial calcifications and help restore arterial flexibility. So you can enjoy those types of cheeses on a daily basis. Brie, Gouda, Jarlsberg in particular are very high in Gruyere. Or you can take a vitamin K2 supplement. The highest known food in vitamin K2 happens to be a plant-based food if you enjoy or are following a plant-based diet. Traditional Japanese fermented soybean food called natto. It's a breakfast food commonly eaten in some areas of Japan and happens to be very, very high in vitamin K2. And it's been shown to benefit the heart health and bone health of the people who eat it in the regions where they eat this. So if you have an Asian grocery store, you might be able to find this in little freezer packs. Just thaw it and put it on rice, and it has, as you can see, a unique texture, also and flavor to it. Or if you are not into that, then a supplement is a good option. The supplements are made from the same bacteria used to make natto, and they come in veggie caps either on their own, just the vitamin K2, or in combination with vitamin D, because vitamins D and K work together, so it can be convenient to take them together. Some people are already taking vitamin D, so they can just buy K2. Others, like I, take K and D and give that to my kids because it's just convenient. So this is something that will help guide calcium into bones and teeth, keep it away from arteries, promote healthy bone density, and it's an important, arguably my top nutrient. Well, it's neck and neck with the one I'll talk about next. So that's vitamin K2. Okay, so next, my next top nutrient, I guess that vitamin K2 is the top vitamin, this is the top mineral, and they really do work well together, is magnesium. Magnesium is important for so many things. It is absolutely the stress relief mineral. It supports healthy blood pressure, which is a really important risk factor for heart disease. It is an anti-stress mineral. It works with the vitamin K2 to keep calcium in its place. So just magnesium alone will help keep calcium in check and in balance to a certain extent. And it does this because magnesium helps to support endothelial function. Without optimal levels of magnesium, our endothelium can't be healthy. And it's not easy. Oh, I thought I had a slide here that showed what the recommended daily intake of magnesium is. The recommended daily intake of any nutrient is typically the bare minimum that we need to prevent being deficient in it. The recommended daily intake of magnesium is 400 milligrams per day for adult men, and about 300, actually I think it's technically 360 for adult women. So that's a lot, and that doesn't happen without some careful meal planning. Lots of green leafy vegetables, whole grains, nuts and seeds on a daily basis, and or a supplement, because it's just tough to get in that much magnesium. And if you're under stress, for example, you may need more magnesium. And so that's really challenging to get just through diet alone. And if you have concerns about heart health or your blood pressure is elevated, then you need even more magnesium. So that can be really tough to meet just through diet. Lots of research showing that low magnesium promotes endothelial cell dysfunction. In other words, if you don't have lots of magnesium, your endothelium will suffer. And that has implications for atherosclerosis, in other words, hardening of the arteries, inflammation, and thrombosis, in other words, formation of clots in the blood vessels. There's a lot of magnesium options. I am not going to, because I don't want to overwhelm anybody and we only have so much time. The point of me showing this big slide with so many different things on it is to say that getting in extra magnesium is a good idea, and there's lots of ways to do that. So in addition to eating a healthy diet with, as I mentioned, lots of green leafies, whole grains, nuts and seeds, magnesium supplements come in chewable tablets, powders that you can drink, capsules that you can take. They come in flavored versions, even children's versions, because kids need magnesium too. There's just lots of options for magnesium supplements. And I personally take one every night at bedtime, or if I have muscle cramps, like I was gardening and got some muscle cramps, I'll take extra, because magnesium is wonderful for relaxing muscles, relieving muscle cramps, as I mentioned, helping to lower blood pressure. There's two main types of magnesium that you'll see on the market. Magnesium citrate, which I refer to usually as cheap and cheerful. It's inexpensive, usually quite straightforward and effective. I really like magnesium citrate. Some people find, especially if they take a lot of it, they want to take it in for whatever reason, high amounts. It's hard on the digestive tract, or it can give them loose stools. So if that's the case, then magnesium bisglycinate, these two bottles over here, that's a form of magnesium. It's a little bit more expensive, but it is gentler on the stomach, and it won't cause any kind of digestive upset. So here's some options I just wanted to show for different types of magnesium supplements. Okay, so then next is benefits of omega-3 essential fatty acids. So these are healthy fats that you can get in your diet, but again, somewhat challenging. Grass-fed animal foods, if you can find them, are a source of omega-3 essential fatty acids. Like I said, before, hard to come by. The best sources of omega-3s in the diets are is fish oil from the smash fish. What's called smash, or the deep cold water fish: salmon, mackerel, anchovy, sardine, and herring. Now, the larger fish can be problematic. You shouldn't necessarily eat those on a daily basis because of environmental contaminants that we can find in large fish. Small fish like sardines you could eat on a daily basis to get your omega-3s. And there are plant-based omega-3s from things like flax and hemp, for example. Those are short-chain omega-3s. The body needs to convert them to the long-chain form. So if you're really concerned about heart health, brain health, skin, cognitive function, then a pre-formed omega-3 can be very helpful. So from a fish oil, for example. Lots of research about omega-3s and health in general, but specifically when you look at omega-3s and heart health, they have been shown to lower triglycerides, which is another problematic fat, reduce blood viscosity, in other words, helping to prevent blood clots. Lower inflammation. Omega-3s are wonderfully anti-inflammatory. They will absolutely improve and are a great thing for endothelial health. And taking a quality omega-3 supplement can reduce the risk of death due to cardiovascular disease by up to 62%. This is significant, and it's a really important part of heart health. When it comes to fish oil, there are a lot on the market, and there's a big difference between different types of fish oils on the market. Purity and potency are really important. In other words, purity, first of all, making sure the big advantage that fish oil has over just eating fish, not to say you shouldn't eat fish, but you can't eat large fish every day because of environmental contaminants. Fish oil is purified to remove those contaminants. So, but it has to be tested to make sure that the impurities and environmental contaminants have been removed, and that during the processing, the oil itself was not oxidized or damaged. So that absolutely needs to be tested. This symbol in the top right corner of this slide, Ishura, the little flower, is one way that you can know that any supplement, including specifically fish oil that you're taking, has exactly what it says on the label, and nothing that you wouldn't want in there. In other words, no oxidized fats, environmental contaminants, pesticides, solvents. So that is an assurance of the quality of the fish oil that you're taking. So it's important, and that's how you know that your fish oil supplements are free of environmental contaminants or oxidized fats. So here's an example of one from the Whole Earth and Sea line. This is the herring gold. This is an environmentally friendly alternative to krill oil. I don't know if krill is still so popular as it used to be. Hopefully not, because it's an environmental disaster. But it does contain healthy fats in a unique form that are very fast absorbing. But you can also get those fats from fish eggs. And so herring gold is in fact herring eggs squished up in a capsule. And this provides healthy omega-3 fats in a high absorbing form for cognitive function, brain health, skin health. Interesting research about psoriasis and this particular herring egg oil. And it also contains the natural brain and liver antioxidant choline, astaxanthin, as well as choline, which is helpful for the brain and liver. And $2 from the sale of each bottle happens to go to the Plant a Seed and See What Grows Foundation. So that's an option when it comes to omega-3s. All right. So one more nutrient that I want to mention before we wrap up that you might not be aware of is quercetin. There's been a lot of talk about this in the last couple of years, but quercetin really is a great, first of all, antioxidant. Again, help keep that cholesterol on your side. Also a great blood vessel protectant. So specifically, quercetin is helpful for the lining of the endothelium, again, which will help to improve circulation in small blood vessels. And this is considered to be a blood vessel protectant. Quercetin is a bioflavonoid. It's a vitamin-like molecule that you will find in all kinds of plant-based foods. The highest known food in quercetin is capers. These little things here, those are the pickled flower buds of the caper berry plant. These are the actual caper berries, I think, over here. But also onions, tomatoes, green leafy herbs, things like cilantro and sorrel and dock. Apples, red onions in particular are high, cherries and berries. These foods are all high in quercetin. So quercetin does a number of things for the blood vessels, helps to improve, as I mentioned, the function of the endothelium, helps to reduce platelet stickiness or reactivity. Again, that is something that potentially can help prevent clotting in the blood vessels. And it has a certain amount of anti-inflammatory and a lot of antioxidant effects. Oh, where's my... So for people who are concerned about blood vessel health, quercetin, and by the way, also happens to help with seasonal allergies. And so this is a great time of year for people if you suffer from that. Quercetin lipomycel matrix is a form of quercetin that is high absorbing. So I encourage you to eat all those kinds of foods that I showed. And if you really love capers, then you can get your quercetin content by eating a small bowl of them a day. That's a lot. But if not, then you can, and you're concerned about cardiovascular health, you can consider a supplement. And quercetin does benefit from enhancement in absorption in terms of supplements. So quercetin lipomycel matrix is formulated to achieve that. And as I mentioned, it's a blood vessel protectant. It helps to protect against free radicals, and it's often used at this time of year for immune support. So this specific brand has up to 10 times higher absorption than a standard quercetin supplement. Okay, so the last thing I'm going to mention, and I did touch on this before, is laughter. It was one of the first things I mentioned as being helpful for the endothelium. And this has actually been studied. Laughter appears to cause the tissues that form the inner lining of the blood vessels, in other words, the endothelium, to dilate and expand in order to increase blood flow. So whatever you can do to laugh, we know that exercise is helpful, but they say laughter is the best medicine, and this research seems to back that up. Certainly when it comes to heart health, laughter seems to be a very good medicine indeed. I mentioned already the Ishura, important not just for fish oil supplements, but all supplements. But for people who are wondering, how do I know I'm getting exactly what it says on the label? Look for the Ishura symbol. This is Canada's largest third-party testing facility for checking for GMOs as well as contaminants, 700 different contaminants, well above and beyond the Canadian guidelines and requirements. Okay, and so that sort of wraps up, and that's a look at some of the nutrients that I spoke about for heart health. And we have about 10 minutes now for questions, if there are any. I know that's a lot of information to share in a short period of time, so feel free to type in questions if you have them.
Thank you so much, Dr. Kate. That was a fantastic presentation. I haven't seen any come in yet, but we'll give the crowd a few minutes to type those questions in the Q&A section or in the comments. And just a reminder, if you happen to miss the beginning of the presentation, don't forget to stop into your local Netters on Saturday to celebrate with us our 40th anniversary. Some great deals going on. Plus a really special deal coming from Natural Factors. And that's all I'm going to say on it. So, because I really don't know the details. So go ahead and type those questions in. And yeah, I'll leave it to Dr. Kate.
Let me see, Janine's on the line. Hi, Janine. Yes, please celebrate your slightly elevated cholesterol. It's a good thing. You can have some brie cheese and red wine to celebrate your elevated cholesterol.
Dr. Kate, I actually have a question in regards to brie. A lot of us will bake brie. Does that impact it at all? Does it impact the nutrients of it at all?
No, it's not very high temperature usually in baking, right? It's just like sort of getting it melty. And there's a, vitamin K2 is slightly affected by heat, like they've done studies on calf liver, raw versus cooked or whatever. There's a little bit of effect, but not a lot. There's so much brie, or so much vitamin K2 already in the brie that it's not a big deal.
Nice. Oh, we do have a question in the Q&A section.
In the Q&A, oh yes, here we go. The wrong section. Oh, is there a better time of year to check our cholesterol? That is a great question that I don't off the top of my head know the answer to. I mean, the standard answer would be no. But I wonder if maybe wintertime is a better time to check I would think that if we're under stress or depending on our diet, it will absolutely vary. But for the most part, it doesn't vary a lot from, throughout the year that we know of. But now I'm going to go check it out. I know that arterial calcification can have annual or seasonal variations and tends to be more in the winter than the summer, a little bit. But I don't think our cholesterol varies quite as much in the same way. How much calcium to take in a day? That depends on the individual. So for most people, a calcium supplement isn't required unless you have a diagnosis of osteopenia or osteoporosis. Then you probably don't need additional calcium from a supplement. If you do have osteopenia or osteoporosis, I usually recommend up to 500 milligrams of supplemental calcium per day, and you don't usually need any more than that. What would cause blood pressure to go from 60 in the morning to 10 at noon? So I don't know exactly which numbers. Yeah, you need both of the numbers in the blood pressure. I'm not sure if you're talking about the systolic or diastolic. But blood pressure is often higher in the mornings than later in the day. So in the morning, our cortisol level goes up. It normally should go up in the morning, and that can cause our blood sugar to rise, can cause our blood pressure to rise, because it's sort of like our get up and go in the morning. And that can decline as the day goes on. There's usually not such a big change or such a big difference in it, but that certainly can happen in that as the, did I say cholesterol? I think I said cholesterol, but I meant to say it was cortisol. I hope I said cortisol. It's late for me here. And so, sorry, our cortisol is up in the morning and then it decreases as the day goes on. So that may be the difference between the higher and lower blood pressure. All right, let's see if there's any other questions.
Looks like we have one in the chat section, Dr. Kate.
Okay. I was told having BIED. I'm not sure if I know what BIED is. That not to take supplements, the system isn't going to use them, but she didn't say why. I do want to take some of what you spoke of, but specific supplements. I do have fatty liver and take statins for it, but okay. Statins won't reduce it won't help a fatty liver, but I don't know what this BIED is. Sorry, so you'll have to, if you want to elaborate on that. I mean, I can't give any specific medical advice, but I don't know what the BIED stands for.
And we have a couple more in the Q&A section.
Okay. Oh, okay. So first question is, what is the difference between CoQ10 and ubiquinol? So Natural Factors has both. So CoQ10 comes in two forms, ubiquinone and ubiquinol. They both work. Ubiquinol is a little bit more effective. It's also a little bit more expensive. So it depends on your budget. But Natural Factors offers both standard CoQ10, which is ubiquinone, or the ubiquinol, which is what's called a reduced form of CoQ10. Although reduced sounds like a bad thing, it actually means that it's slightly more effective as an antioxidant. Ultimately, when you take a CoQ10, they sort of go back and forth between these two forms in the body, but the ubiquinol is a somewhat more powerful antioxidant, which is why it's a little bit more expensive. Would you recommend taking B5 to reduce LDL cholesterol? I have seen more research with vitamin B3 to reduce LDL cholesterol. If you really want to reduce it, then B3 or niacin can be a way to do that. Best time of day to take a calcium supplement. There's no particular time, just take it with food up to 500 milligrams of calcium per day if you have been diagnosed with osteopenia, as you mentioned. I was under the impression that magnesium should be taken in the morning. Oh, that's interesting. No, not necessarily. Magnesium, very nice taken at nighttime, at bedtime, can provide a very relaxing, peaceful type sleep. Nice for if you have, say, leg cramps, muscle twitches, this kind of thing. But it can be taken at night, can be taken in the morning, can really be taken at any time. What about nitric oxide? Oh, so that's interesting. So nitric oxide is a compound that the body will make that will dilate blood vessels. And there are certain supplements that can increase nitric oxide production, like L-arginine, for example, an amino acid, and it is certainly a factor in blood vessel health, but the other nutrients I mentioned are more important, or priority nutrients for that. How high is too high? Is there a number that would be considered too high? I guess we're talking about cholesterol here. That really depends on, I don't usually have a cutoff number. It depends on the individual, their lifestyle, their personal and family history, as well as if the cholesterol is oxidized, how, is the HDL also high? Then that's a good thing. So really, there's a number of factors involved. I don't usually give a specific, say, cutoff where it's a concern without looking at, all the facts and the whole picture.
Fantastic. Well, that is 8 o'clock. So I think we'll wrap it up there. Again, Dr. Kate, thank you so much for joining us tonight. Another great presentation. And thank you to everyone who hopped on the webinar tonight. I hope you had some great information. And again, if you have any questions about the supplements or the products discussed here tonight, feel free to stop into your local Nutters and talk to the vitamins manager or any one of the associates, and they'd be happy to help you out. Again, thanks for joining us tonight, and we'll see you next time.